Other targets are portal hypertension, basically cardiovascular disease. You want to know the cardiac pressure. A particular one that we wanted to target is the portal hypertension, where a portal vein, which is a vein in the liver, essentially gets a higher pressure, and it's quite harmful for the body, or it's really an indication of a critical cardiovascular disease. Right now, the way people diagnose that is by invasively inserting a catheter inside the portal vein, which of course runs the risk of infection, comorbidity, etc. Whereas what we are thinking of is that can we non-invasively use ultrasound imaging to find that? How will you do that? So the pressure in that particular organ is higher. So what we want to do is we want to inject the patients with bubbles. The bubbles will go into that high pressure region. So the bubbles images that you will get will be different when there is a high pressure versus when there is a normal pressure. So just sort of comparing between the two, can we say, well, there is a high pressure. So our idea is that if we understand the underlying physics, we will be able to design it better. We will be, right now, even if they get a bubbles, they will just say, well, I will try this size versus that size and see which one gives you better things. But what our goal is, why this particular size is doing better. I think the goal of clinical enterprise is that early accurate diagnosis of a disease and effective intervention without systemic toxicity. So if you think of it, diagnosis is where the ultrasound imaging comes up, because compared to CT and MRI, it is inexpensive, it is non-ionizing, it is, unless there is a critical conditions, you know that the pregnant woman only can have ultrasound. So improving ultrasound image is something which is a larger goal in the research, or the basic science research that I do in collaborations with people who are really the imaging community. So the bubbles form a pivotal component there, because all the other imaging, for instance, MRI or CAT, others have contrast agent, which is what helps improving the quality of the image. So if you do an MRI, they will be injecting something there. For ultrasound, the bubbles is that, because bubbles essentially can be delivered into the body through the injection into the bloodstream. It can go everywhere, but bloodstream can take exactly like other contrast agent. And it has the ability to reflect ultrasound. And it's also, so that's one of the things which goes to the early diagnosis part. And secondly, of course, the research as we are looking into is delivery, the drug delivery with my collaborator, the targeted drug delivery, so that it goes and targets cancers where we want them to be, and without systemic toxicity, and ability to reach inside the densest tumor through ultrasound, so that we can push that.